It is important to be as fit as possible before undergoing a total knee replacement, as this will make your recovery much faster. Ideally, you would start the preoperative exercises 4 to 6 weeks prior to surgery to give yourself time to build strength. In general, start gently with 5 to 10 repetitions, working up to the 20 repetitions twice a day. Stop doing any exercise that is too painful. Depending on the specific exercise, exercises should be done while lying on a bed, sitting in a chair, or standing. It is not recommended to do the exercises while lying on the floor due to the difficulty getting up and down with a painful joint. Refer to your guidebook for specific instructions on the number of repetitions and frequency of exercising. Ankle pumps are done to encourage circulation, prevent blood clots, and are helpful for your balance. Gently pull the toes up towards you and then push them away again. Do both ankles either together or alternating. After surgery, ankle pumps should be performed throughout the day. Quad sets strengthen your quadriceps or thigh muscle, which is important for standing, walking, and going up and down stairs. With both legs flat, slowly tighten your thigh muscle, your quadriceps, while pushing your knees down into the surface. To emphasize the quad muscle, you may also try to bring your toes up towards your head. Look and feel for the muscle above the knee to contract. If done correctly, the heel may slightly lift off the surface of the bed if you have enough range of motion. Hold the muscle contraction for 10 seconds. Do not hold your breath while you count. An alternate position that may take pressure off of your back would be to bend one leg and place the foot on the bed. Perform the quadricep muscle contraction with the leg that is lying flat on the bed. Once you're ready, switch legs and perform with the other side. Glute sets, or buttock squeezes, work the gluteal muscle, which is important for standing, walking, and going up and down stairs. Squeeze buttocks together as tightly as possible while still being comfortable. Hold for 10 seconds, remembering not to hold your breath while you count. You can check to see if you're doing the exercise properly if you see a gentle rise of your hips up off the bed, and when you relax, they sink back down again.
Hip abduction works the gluteus medius muscle on the side of your pelvis. This muscle is very important for walking. Hip adduction works the inner thigh muscles, which also help in everyday movements such as walking and getting in and out of bed. Slide your leg out to the side, moving the leg only as far as comfortable. Keep the kneecap and toes pointing straight up towards the ceiling. Don't let the leg rotate in or out. You can help keep the leg straight by tightening the top thigh muscles as you slide your leg out and back in. Perform this exercise slowly with a 5 count out and a 5 count in. After surgery, we will have you perform both legs at the same time. Please feel free to practice the exercise this way before surgery if you would like to. Bring both legs out to the side and back in. Sometimes it may be difficult to slide your legs across the bed if your bed is too soft or if the bed covers give too much friction. You may find it helpful to put your leg in a plastic garbage bag when performing the exercise, making it easier to slide. If your bed or mattress is too soft and you feel like you need to lift your leg in order to clear the surface, you can make the bed surface firmer by placing a sheet of clean cardboard or a plastic surface over the top of the mattress underneath your leg.
Heel slides work your hip flexor muscles, which are important for walking and going up and down stairs. Bend your knee and pull the heel towards your buttocks, actively sliding the heel along the bed. Sometimes it may be difficult to slide your leg across the bed if your bed's too soft or the bed covers give too much friction. You may find it helpful to put your leg in a plastic garbage bag when performing the exercise, making it easier to slide. If your bed is too soft and you feel like you need to lift the leg up to clear the surface, you can make the bed surface firmer by placing a sheet of clean cardboard or plastic surface over the top of the mattress underneath the leg. The straight leg raise works the hip flexors and quadricep muscles, which are important for walking and preventing your knee from buckling. Bend your non-exercising knee, placing your foot on the mattress. Keep your exercising leg as straight as possible and tighten the muscles on top of the thigh. Slowly lift your straight leg about 10 inches from the surface and hold for 2 seconds. Make sure the straight leg is maintained and the knee does not bend with the lift. You may want to pull your toes forward to activate the muscles. Go slowly. If you need assistance, have your coach place their hand under the heel, or you could use a band or belt to help you lift the leg. Place the band around your foot and lift the leg using your arms to help only as much as you need. Remember, this is a leg strengthening exercise. The short arc quad strengthens your quadriceps or thigh muscle, which is important for standing, walking, and going up and down stairs. This exercise requires a firm towel roll about 6 to 8 inches in diameter. You can make a rolled towel by using a large beach towel. Fold it into half or thirds depending on how wide it is. Roll it up nice and tight. You can secure it with some rubber bands or tape. Some people find it easier to wrap a towel around an old coffee can. To perform the exercise, place the rolled towel under the exercising leg. Lift your heel off the surface and straighten the leg by tightening your thigh muscle or quadriceps. Make sure you keep your knee on the roll when you're straightening the leg. Hold for 5 seconds. Remember to work for full extension, straightening the knee. If you have someone assisting you, they can place their hand under your heel to help. Sitting knee extension or long arc quads strengthen your quadriceps or thigh muscle, which is important for standing, walking, and going up and down stairs. Sit in a chair comfortably with your thigh resting on the chair for support. Slowly straighten your leg and hold it for 5 seconds. Lower your foot back down so it is resting on the floor. You should try to completely straighten the knee, but you do not want to lift your leg so high that your thigh starts lifting off the chair. Remember, the motion is at the knee.
Your arm muscles are very important after surgery because you will be relying on them more to help you get in and out of bed, in and out of a chair, and walk with an assistive device when your surgical leg is healing. Sit in a chair with arms. Place your hands on the armrests. Push up with your arms slowly, and then lower back down slowly. Since this exercise is designed to strengthen your arm muscles, not your legs, try to focus on letting your arms do most of the work as you complete this exercise.
The knee extension stretch will help lengthen the muscles on the back of your leg, which can get tight when your knee isn't moving well. Getting your knee straight is an important part of recovery because if you don't get that extension or leg straightening, you will limp while walking. Due to range of motion limitations before surgery, it is important to stretch these muscles both in preparation for surgery and after surgery with your new knee. Prop the foot of the knee that is to be stretched on a chair. Place a small rolled towel under your foot right above the heel. This will prevent your heel from getting sore during the stretch. Then place a 5-pound weight above the knee. You don't have to purchase a 5-pound weight. You may try using a bag of beans, rice, or birdseed. The weight just needs to drape above the knee and weigh about 5 pounds. Sit back and try to relax for the next 20 minutes. You may apply ice to the knee at the same time to help with pain control. If the sitting position is too uncomfortable, you may try performing the stretch lying down on a bed with a large towel roll under the ankle.